Did you know that your liver is the largest internal organ in your body and does over 500 tasks, including detoxification and storing vitamins? This makes it super important for us to take good care of our liver. But how do we do that? Well, being aware of the warning liver health signs that your liver might be in trouble is definitely a good start. So let's explore the 11 liver health signs that can be detrimental if you ignore them. Now, before we continue, we advise our viewers to consult with a doctor or a registered dietitian before making any major dietary changes. Now, subscribe to the channel and let's explore. Just like a car needs regular servicing to run smoothly, your liver also needs your attention. Sometimes our bodies send us signals when something is off, and our liver is no different. And by paying attention to these warning liver health signs, we can ensure that our trusty liver keeps doing its job effectively. So here we are, helping you out with the 11 liver health signs you can't afford to ignore. Number 11, pressure issues. If you experience uncomfortable pain along the right side of your rib cage, particularly after having a meal, this discomfort can be because the body of your liver has become thicker from damage, which then obstructs the tiny channels leading to your gallbladder. This obstruction results in pressure and discomfort that spreads around your ribs and might even affect the phrenic nerve, causing muscle tension and shoulder pain. If you experience any of these symptoms, then it's time to go for a checkup. Even the tiniest liver health signs can lead to something bigger, so don't ignore them. Number 10. Dark urine. Although it might strike you as odd to focus on your urine's colour, it could actually tell critical details about your liver's well-being. Typically, urine has a faint yellow hue, but if you spot it turning darker than usual, it could indicate that your liver is contending with some complications. Darker urine implies that there may be a hiccup in how your liver is processing bilirubin. Consider it a red flag raised by your body. While this may not mean you need to sound the alarm bells, it's certainly a cue that you should be vigilant. If you regularly observe dark urine, it would be wise to schedule a visit with a healthcare expert. They'll be able to carry out an in-depth investigation to pinpoint the root cause and tackle any looming liver-related problems before they escalate into something more grave. Number 9. Poor night vision. When you realize it's getting tougher to see clearly or concentrate at night, especially when the lights are dim, it might suggest that you lack retinol, also known as vitamin A. Your liver produces a substance called bile that comes into play here. This bile helps your body soak up vitamin A, a key player in assisting the rod cells in your eyes to adjust to varying degrees of light. However, if you're suffering from liver disease, it could lead to a shortage of this crucial bile. As a result, your body might not take in adequate amounts of vitamin A, causing a condition dubbed night blindness. Moreover, if your eyes are dry, sore, feeling gritty and irritated, it might signal a possible underlying issue with your gallbladder being clogged. Number 8. Yellow stool. When your stool changes colour, it's like your liver is quietly asking for some help. Usually, your liver sends out something called conjugated bile acids. These are really important for breaking down the fat in what you eat and giving your poop its usual colour. But if your liver is dealing with something like fatty liver disease, it has trouble doing this job. It might not send out the bile like it should through the right channels. You might then notice your stool looking lighter and even floating thanks to fat that hasn't been properly broken down. This is a clue that your liver might need some attention. So keep an eye out for any changes in your stool colour and consistency. Number 7. Extreme fatigue. Feeling tired all the time? Your liver might have something to do with it. When your liver is struggling to function properly, it can lead to a condition called chronic fatigue. This means that you could feel exhausted even after a good night's sleep. You may find yourself needing frequent naps or feeling drained even if you haven't done anything strenuous. The reason behind this extreme fatigue is that when your liver isn't functioning at its best, toxins start building up in your body. These toxins can make you feel sluggish and drained even if you're getting enough rest. If this fatigue persists, it's important to consult a doctor to determine the root cause and address any underlying liver issues. Number 6. Unexplained weight loss. Sudden weight loss can be concerning, but it's particularly alarming when there's no obvious explanation for it. If you find yourself losing weight without making any significant changes to your diet or exercise routine, it could be a red flag for liver disease. When the liver is damaged, it struggles to properly metabolize and store nutrients from food. This can lead to unintentional weight loss as the body isn't getting the necessary nutrients to maintain a healthy weight. Additionally, if your appetite decreases due to an underlying liver issue, this can also contribute to sudden weight loss. If you're experiencing unexplained weight loss, consult with a medical professional to rule out any potential liver problems and address them promptly. Number 5. Spider veins. Here's what's going on. Those red dots that look a bit like a spider's web on your skin, they're called spider veins. They're the result of your blood vessels getting a bit of a beating because your liver isn't doing its cleaning job properly. Now, what's causing all this? Lots of estrogen in your body. It's messing up your blood vessels, making them bigger and showing their complex layout on your skin. If these liver health signs ring a bell with you, don't just sit there and wait. It's doctor's time. Ask for an ultrasound test, which isn't scary at all. It simply uses sound waves to create a picture of your liver and its blood vessels, and it can highlight any hidden fatty areas. Unlike other organs, what's really cool about the liver is that it can heal itself. But here's the thing, to reverse liver disease, you need to understand its stages. It starts with a harmless buildup of fat, leads to inflammation, and ends with the formation of scar tissue known as fibrosis. From here, it can worsen into a severe condition called cirrhosis. Even though it sounds serious, remember the liver's ability to self-heal. With some care, it can bounce back better than ever, offering a truly impressive comeback. Number 4. Itchy skin. The liver plays a crucial role in filtering out toxins and waste from your body. When it's not functioning properly, these toxins can build up and cause skin irritation and itchiness. This is especially true if the buildup of bilirubin, a yellowish bile pigment, is causing jaundice, which can also lead to dry, flaky skin. If you notice persistent itching without any other apparent cause, it may be a sign of an underlying liver issue. Consult with a doctor to determine the root cause and address any necessary treatments. Number 3. White nails. Similar to the previous point, white or pale colored nails can also be a sign of liver problems. This is because the liver is responsible for producing proteins that are necessary for healthy nail growth. When the liver is damaged, it may not produce enough of these necessary proteins, resulting in weak and pale nails. Additionally, if your body isn't absorbing enough nutrients due to an underlying liver issue, this can also contribute to changes in nail health. Number 2. Cracked heels. You may not think of your liver when dealing with dry and cracked heels, but it can actually be a sign of an underlying liver issue. The liver plays an essential role in maintaining adequate levels of fat-soluble vitamins like vitamin A, which is crucial for maintaining healthy skin. When the liver is damaged, it may struggle to produce enough vitamin A, leading to dry and cracked skin on the feet. If you notice this symptom, along with any other liver health signs listed here, consult with a doctor for further evaluation. Number 1. White eyelid growths. A less common but significant sign of liver disease is the appearance of small white-colored bumps on the eyelids called xanthelasma. These growths are made of cholesterol deposits and can indicate a buildup of fats in the body due to liver dysfunction. If you notice these growths on your eyelids, it's important to consult with a doctor for further evaluation and potential treatment options. Additionally, addressing any underlying liver issues may also help reduce the appearances of these growths over time. Good news then, your liver is pretty amazing, and with a bit of tender, loving care, it can recover. So how do you reverse liver damage? Start by improving your diet. Say bye-bye to sugar and starchy foods like bread, sweets and soda. A liver that's been hurt doesn't like fructose, so you also have to bid goodbye to fruit juices and alcohol. Now, if you like this video and learned something new, hit the like button and share it with your friends. Remember to subscribe to our channel for more videos on health and wellness. Thanks for watching.